infantile spasms is really a unique seizure type that we see in infancy and typically under children the age of 1. Sometimes we see it out to the age of 2. I think it's really a tough position for parents because they may not be expecting for their child to have seizures and not really knowing what to look for. And I think the first step is really the awareness of something may be wrong, and to touch really accept and be aware of their gut feeling that something is wrong with their baby. And then, with the use of the internet, which is so much an element of our everyday lives, having the internet as a resource, and some of the websites in terms of the Epilepsy Foundation and the Tuberous Sclerosis Alliance are really good resources to find videos that show you what babies do. So I think trusting your gut, looking for resources that give you a good illustration of what spasms may look like, because it comes in a variety of forms and it may not all look the same. And then really reaching out to your pediatrician and videoing the event and getting them to look at it. And to me, if the question crosses your mind as a clinician and you're concerned about it as a parent, there's a simple way to confirm it, and that's with getting the EEG. And I think one important point is that as we become more aware of how spasms may begin, or it may not begin as a spasm, but a focal seizure and then evolve into a spasm, getting the EEG may not show you the classic correlation of a hypsarrhythmia, but it may show early changes that are abnormal. And I think taking the clinical history, and if the family has a video with the EEG, as a clinician, you can make the call as, yes, that is a clinical infantile spasms, and then you move forward with your management plan. But I think early awareness, early reaching out to your pediatrician, and then getting a quick referral to neurology is absolutely critical, because we know the earlier it's recognized and intervention starts, it really has a positive impact on development.
Yeah, obviously it's hard. There's a lot of small nuances with some of these seizures, especially from babies. It's hard to kind of see any sort of major differences with some of these children. So obviously, taking the right steps is definitely the right way to go. And if you see something, to say something and kind of make an action plan behind it. Dr. Bebin, from a treatment standpoint, obviously we've got a lot of the same sort of anti-seizure medications that we've been using for several years, but are there ways in which we've optimized or even gotten better with the detection, the diagnosis, and then the subsequent treatment of infantile spasms? I know obviously you talked about how it is a very timely disease to kind of get to and things of that sort. So talk a little bit about ways in which we've optimized the treatment aspects.
So I think ultimately the goal is for a cure. And I think the ultimate kind of hurdle that we're getting closer to is looking at this from a preventative standpoint. And the biggest help there is if you know the baby is at risk because they have a particular genetic condition. With the advent of prenatal care and getting ultrasound, fetal MRI, so the fetal imaging is becoming more and more important and more a common practice, because you can identify malformations of brain development with some of the genetic conditions that can be diagnosed very early. So even before the first seizure, even before the EEG is abnormal. And that gives you really a step ahead on planning, to knowing the risk and to educate the family. It may be spasms plus another seizure type. So moving into the preventative realm with the use of genetics and fetal imaging is game changer in terms of our potential approach. And then that kind of the ultimate goal gets into personalized medicine.